Welcome to the next installment on medicinal chemistry. This section, we will talk more about the specific drugs under adrenergic agonists. So our adrenergic agonists act as non-selective, as mentioned in our previous topic, if they contain beta-phenylethylamine chain. And we have already discussed it in robust lecture in the previous videos. So beta-phenylethylamine is the main structure that is needed for our drug to elicit non-selective adrenergic agonism. So further modifications can result to selectivity and specificity on the receptor it acts, or it can cause other way around such as antagonism. So we refer as our beta-phenylethylamine as the general pharmacophore for adrenergic agonist activity. So let us recall the example for our non-selective adrenergic drug, the norepinephrine and epinephrine. So it interacts directly with our adrenergic receptors to elicit a response. Thus, the pharmacological application of this agent results in activation of both of alpha and beta adrenoreceptors all throughout our body. So remember that our epinephrine is given intravenously and it is used to treat cardiac arrest or in hypotensive crisis. So it can be useful, for example, in anaphylactic reactions, or it can be used to resuscitate our patient. This is due to its adrenergic agonism that results to vasoconstriction and also positive inotropic and chronotropic effects. So epinephrine is also mixed with local anesthetics. So epinephrine, because it's vasoconstrictor, it can be in combination with our lidocaine. So our lidocaine will be limited, will be producing a localized vasoconstriction effect due to the incorporation of epinephrine to it. This is to prolong the duration of action and to minimize systemic effects of our anesthetic. Now let us continue with the specific adrenergic agonist that acts on our beta receptor, or we call it selective beta adrenergic agonist or the beta agonist. So remember that in our catecholamine pharmacophore, if our N is substituted with isopropyl, or the N with our amine is substituted with isopropyl, or any aryl or alkyl group, a bulky group with a very strong steric property, it can give us a specificity and selectivity that favors our beta receptors. So I want you to look at or to look for the structure of dobutamine. So dobutamine has a bulky N substitution that helps it with an increased selectivity on its beta 1 relative to beta 2 receptor. So dobutamine is useful for our acute heart failure due to its positive ionotropic actions on our myocardium. So via the beta 1 receptor stimulation, it leads to increased our myocardial CAMP, which increase the opening of our L-type calcium channels and our intracellular calcium. Therefore, it follows or it creates an enhanced contractility of our heart that is helpful for acute heart failure. Another example is alteration of beta hydroxyl on the benzene ring to the methoxy group. An example for this is albuterol. Another one is in our catechol ring that is involved with terbutaline. So these two, they have increased selectivity with beta receptor. So in contrast with dobutamine, our albuterol here and terbutaline has a better selectivity with our beta 2 compared with our beta 1 receptor. So this time, I want you to look for the drug literature and check for the structure of our albuterol and terbutaline, and kindly identify the difference in their substitution that confers its beta-2 agonism and its difference with dobutamine, which is beta-1 agonist. Another example is isoproterenol. So this is a non-selective and a prototypical beta agonist. So it has virtually no activity on our alpha receptor because of the isopropyl attached to our N, to our amine here. However, it does act both for our beta 1 and beta 2 receptor. So our dihydroxyl substitution here in our benzene ring results in the property of our isoproterenol to have a sensitivity with air and light. Also, it is easily metabolized by our COMT, and it can undergo, because hydroxy or hydroxyls are susceptible to conjugation, so it undergoes sulfate and glucuronide conjugation upon metabolism in the liver. So it has poor absorption due to its hydrophilicity, therefore it has a short duration of action. So these three examples here belongs to the class or the structural class of resourcinol. So its parent structure here is resourcinol, but our metaproterenol, terbutaline, and our phenoterol, which is not part or which is not displayed here and will be one of your activity, their parent structure is called resourcinol. So they are called as resourcinol bronchodilators. They have 3,5-dihydroxyl groups of the phenyl ring, compared with the previous discussion that we have that um, the dihydroxy is located in the 3,4. This time, it's located in 3,5 dihydroxyl, which confers the beta-2 receptor selectivity that is useful for our bronchial musculature relaxation, helpful in patients with asthma. So if you try to look closely to our metaproterenol and terbutaline, they both contain 3,5-dihydroxy substitution in the phenyl ring. Now, on the other end, it has different substitution in the amine tail. So it has it has isopropyl on the metaproterenol, and the other one has third butyl substitution. So our metaproterenol has beta directing and isopropyl group, and it is less beta 2 selective compared with terbutaline, which is both beta 2 directed third butyl group that causes our cardiac stimulation. So metaproterenol has a lower affinity for beta 2 receptor compared with our isoproterenol, the one mentioned in the previous slide. And because this is already 3,5-dihydroxy, compared with isoproterenol, our metaproterenol has a longer duration of action because it is more resistant to our COMT or our MAO enzyme or the MAO enzyme, which allows longer duration of action due to the resistance of our metabolizing enzyme. So for your activity on this section, please look for the structures of albuterol, formoterol, and salmeterol. So these are selective beta-2 agonists that results from replacement of the meta-hydroxyl group of the aromatic ring with hydroxymethyl moiety. So these three commonly has a duration of action that ranges of 3 to 6 hours. So they have an action on our bronchial muscle contraction, and it has optimal direct acting beta 2 receptor selectivity and potency. So with the structure that you are going to look for, please encircle the parts that allows these three structure or these three drugs to have specific lipophilic activity or its lipophilicity property, and also encircle which is the structure responsible for the long duration of action, especially for salmeterol, which allows 12 hours of duration of action. Moving forward, for our next example is our Formoterol. Formoterol is a lipophilic and a long-acting beta agonist. So it has 3 formyl amino beta directing and 4 hydroxyl group on one phenyl ring, and a lipophilic beta directing and isopropyl para-methoxy phenyl group on the nitrogen atom. So please refer to the structures being encircled. These structures work together and it allows formoterol to have a duration of action of 12 hours. So gradually it diffuses to provide prolonged stimulation of our beta 2 receptors. And due to its structure also, it will have a very good resistance against monoamine oxidase and COMT. The next example is our isoserine. So isoserine is the first beta-2 selective drug widely used for the treatment of airway obstruction. So this has also resistance property to our monoamine oxidase. Because of the presence of our beta-2 directing alpha ethyl group and beta directing isopropyl group. So that is the reason why our isoethylene is resistant to MAO. It is metabolized by our COMT and it has a short duration of action compared with or comparable with isoproterenol. So it is used for the inhalation treatment for acute episodes of bronchitis. So our next example is Vitolterol with an active metabolite colterol. So this one is metabolized after pharmacological action by our COMT and excreted via conjugation in the liver. So this is the parent of our isoproterenol, the colterol. Okay, that is the very specific structure of Vitolterol, which allows increased lipid solubility with a longer duration of action of 8 hours. So this is useful for our bronchial asthma and reversible bronchospasm. So once it is metabolized in the body, so the prodrug, your Vitolterol, will be cleaved into colterol and paratoluic acid in our lungs using the esterases.